what brings you to us in your words, and what are you kind of hoping to accomplish?
It can be overlooked because there's so many other things going on with them. And so it's not intentional. And if you asked anyone in CCU or anywhere in our hospital, everyone will say the same thing. Nutrition is really important, but it's not the same as like performing CPR to stabilize a dog, you know, and so when you have the most urgent issues in front of you, you have to address those. And sometimes that can consume all the efforts of that individual or even the team caring for that animal.
I think a lot of clients come out of it feeling very special because it is hard as a veterinarian to take time like that to go into diet. I mean, most people are seeing over 20 cases out in private practice a day, and spending an hour on dietary alone in some of these unique patients is really hard. But nutrition, that's their job and that's what they specialize at, so it's really nice.
So yeah, we just want her to live forever.
More and more people are starting to realize that there's a lot of options now, and you know, food can make a big difference, so we don't always have to go straight to a drug, or maybe we can lessen drug dosage even.
I've been at CSU long enough to where I was a resident doing my training in internal medicine and we did not have nutrition. And there were multiple times where I would have a case that had multiple problems and sometimes competing problems. And when I would talk to my faculty who trained me, I'd say, you know, this patient has, you know, GI, kidney, and liver disease. How do I formulate a diet that's not going to harm one disease or another or exacerbate something else?
You know, I'm going to look at a patient with a very unique lens, and that while every vet is capable of providing nutrition recommendations, I feel like my background and training now allows me to focus on the care we're providing and elevate that level of care.
We get referrals from primary care veterinarians everywhere, out in Colorado and all over the US. We also get internal referrals here from internal medicine and CCU.
So we start by kind of making sure we have a comprehensive understanding of their medical history. From there, then we start to look at, you know, what are our nutrients of concern? What are we going to be thinking of when we're formulating this diet? We may look at a commercial diet and see, can we find a commercial diet that aligns with those nutrients of concern? If we start to find that, you know, really especially with multiple conditions, it can be hard to find a diet that meets all those needs. So then we might start looking at a home prepared diet.
That's one of the biggest feedback I get is they say they like how flexible they are, they like that they can talk at length about everything. You know, a lot of owners really enjoy talking about nutrition and telling them what they're worried about.
When you get that feedback of, oh my gosh, my dog doesn't have diarrhea anymore for the first time in its life, or first time in years, or whatever it might be, or oh my gosh, my pet has so much more energy, and we just changed the food. Those are the good ones that we like to hear.